Since I've been a BMT pharmacist here at North Shore, I've seen too many patients die or have their quality of life limited by fungal infections. And as such, I want to be able to improve how we prevent these fungal infections from occurring in the patient group. My name is Julian Lindsay. I'm a bone marrow transplant pharmacist at Royal North Shore Hospital, and I'm a PhD candidate through the National Centre for Infection and Cancer at Peter Mac in Melbourne. The area that I'm concentrating on is antifungal medications, as fungal infections are a major cause of death and of morbidity in allogeneic stem cell transplants, as they don't have an immune system to be able to fight these fungal infections. The reason I wanted to do the PhD was I saw a lot of patients that were being succumbed to infection-related complications, as well as infection-related deaths. Because an allogeneic stem cell transplant is often the only curative procedure for patients with some types of blood cancers, I found that it was a real risk to focus on as a pharmacist, where we use medication to prevent these infections from occurring. There are two things that I want to concentrate on with the studies with antifungals in allogeneic transplant patients. One is that although we've made leaps and bounds in preventing infections in these patients over the past decade, there is still 5 to up to 10% of patients that will die of a fungal infection after their allogeneic stem cell transplant. The second thing is to optimize the quality of life for patients that are on antifungal medications. For example, there's currently a patient on the ward that has been here for over 6 months because of a rare fungal infection called Fusarium that has limited her and prevented her from being able to be discharged, and has limited her and has affected her family and her 3-year-old daughter, who hasn't been able to see her for 6 months because she's been on a ward without an immune system fighting this fungal infection. Without the funding, I wouldn't be able to conduct this research. It wouldn't be possible. And I feel like this is really important research for my patients and for all of our patients. Research has come so far in the last 30 years, but there's still a long way to go. And I want to thank the Frederiks Foundation for their investment and for believing in researchers like myself to make a difference for our patients and for the survival and quality of life of all patients with blood cancers.